Hello, this is a presentation on psychosis and schizophrenia overview. I am Dr. Latasha McElwain. I am giving this overview of psychosis and schizophrenia to kind of give a little breakdown and overview of the difference between psychosis, and schizophrenia. This is for the purpose of supervision, and this is information that has been collected through research, mainly from the internet. And we'll have the references at the end. So we're just going to go ahead and get started. When we're talking about psychosis, big question is what is psychosis? So, psychosis is a mental disorder characterized by a disconnect from reality. A lot of times, psychosis is the term for a collection of symptoms that happen when a person has trouble telling the difference between what is real and what is not. With that being said, psychosis may occur as a result of psychiatric illnesses like schizophrenia. In other instances, it may also be caused by health conditions, medications, and drug use. So, a lot to say, a lot that was said there, but a whole mouthful to kind of, think about and process through. So, that's why we're doing this presentation, just to kind of talk about the differences and kind of where things fall when we're talking about psychosis and we're talking about a diagnosis of schizophrenia. So, symptoms of psychosis include delusions, hallucinations, talking incoherently, and pretty much a person being having a lot of agitation. The person with the condition usually isn't aware of his or her behaviors. So, with that being said, usually how it's treated is medication and other counseling techniques for the most part. Treatment may include, of course, again, medication, talk therapy, different techniques of talk therapy. We'll go into some of those a little bit later. When we're talking about a psychosis diagnosis, um, requires a medical diagnosis. So there have to be a medical diagnosis of psychosis. Then for the most part, people may experience different issues and concerns. In the behavior area, they might be dealing with some disorganized behavior. They may also be dealing with aggression, agitation, hostility. They might be dealing with, kind of having self harm behaviors. They may be have restlessness. They may also be have repetitive movement. They may also socially isolate. They may also, have a lack of restraint. They might be very hypervigilant, hyperactive. So a lot of times, a lot of behaviors are happening that can help to make the diagnosis of psychosis. And then also we see cognitive concerns. So some of the cognitive concerns we see thoughts, um, thought disorder, like the thought patterns kind of off. They're kind of confused. They may also have beliefs that, that aren't really their own, like different beliefs that come up. They may also have beliefs that are, you know, an ordinary event or, has like basically they feel that they are racing through their thoughts. They're having a lot of they're kind of disoriented. They're definitely dealing with thoughts of suicide sometimes, some unwanted thoughts. They may also be having difficulty understanding false beliefs in superiority, almost like they're grander. So a lot of times individuals are having some issues and concerns in the areas of cognition as well. And then when we look at their moods, a lot of time, some individuals can get angry, anxious, they could be excited, they could be very limited in their range of emotions. They could be in a state where they're lonely, they could be very nervous, So a lot of different things are happening there, as well as when we look at the psychological fears, hearing voices, depression, manic episodes, paranoia. We're going through a whole lot of things there. Hyper religious, that religious delusions, visual hallucinations. Um, then we start looking at speech sometimes. The speech can sometimes, come out very deficient per se, and they could be excessive wordiness, like this excessively. They could also be incoherent with their speech. So a lot of things that happen, and also the rapid kind of frenzy, just the speaking, kind of quickly. Some of them may be on topic, some of them might not be on topic. Also, some common other things that might happen is memory loss, nightmares, and definitely those uh the a lot of the things that go on with individuals, tend to be you know, very interesting, but it deals with all of the symptoms that we have to kind of have there in order for a diagnosis of psychosis to occur. I will say that seeing a lot of individuals come through the emergency room, we do see a lot of folks come through the emergency room with drug addiction. We also see individuals, of course, that come in with schizophrenia, but we see a lot of individuals that come in that's in a state of brief psychosis, and we have to wait to whatever drug that they've been using, or whatever they've been taking. We have to wait to some of that stuff wear off. We have to make sure the BAC level comes down, the blood alcohol level comes down. If it's alcohol, we have to make sure that they sleep off the high that they're on. So we do see a lot of different things. So a lot of these things that I'm actually mentioning are things that I've personally experienced being in the hospital setting. Um, Also, I've experienced a lot of psychosis working with the persistently mentally ill, being on an ACT team out in the community as well. So, two types of psychosis here. When we start talking about psychosis, there are two important types of psychosis to consider. We're talking about hallucinations. When we're talking about hallucinations, we're talking about auditory hallucination, we're talking about visual hallucinations, and we're talking about tactile hallucinations. So all of these have their own kind of way of, showing up for individuals. They manifest in different ways for the most part. You have auditory hallucinations. They're definitely, they can hear other people talking, someone speaking to them, no one else hears it. Visual, they're seeing things, no one else sees it, no one else can, see that person beside them or that person across the room. Same thing when we're talking about tactile. We're definitely talking about hallucinations that involve things you can feel, feeling something crawling on their skin, feeling a sensation or something of that nature. So those things definitely happen. Hallucinations basically, these are when parts of the brain mistakenly act like they would if your senses, your vision, your hearing, smelling, or taste picked up on something actually happening. So sometimes I tell people, you look at it, and an example it gives here is hearing voices that aren't there. So that's, of course, auditory hallucinations. When we start thinking about the other um, important type of psychosis, we get to delusions. When we start talking about delusions are basically they're false beliefs that someone's having, and they're holding very strong to it. They're definitely thinking this is happening or this is going on. Like they're married to the president of the United States, or something like that. They're very delusional in the sense of believing that there's plenty of evidence and belief that shows everyone that it isn't true, but no, that's not happening for them. They believe that, if they believe someone's controlling them, and they believe someone's controlling their thoughts and their actions, and there's a remote control that they're using, yeah, they're controlling them remotely or whatever, and I mean, kind of like that. Or if there, cameras in the house and things like that. I've heard so many um, different things. And so the types of delusions, you'll hear the bizarre delusions, you'll hear the non-bizarre um, delusions, you'll hear the grandiose delusions, and then you'll also hear the prosecutory delusions. So basically, we're talking about the prosecutory delusions. We're talking about delusion where a person believes that someone or something is trying to hurt them, someone's out to get them, somebody's chasing them, someone's behind them. The grandiose is when, of course, they believe that they're a celebrity or have special powers. And then when we start talking about non-bizarre delusions, those are delusions that seem possible, but a person has no evidence to support the belief. Yeah. And then bizarre delusions pretty much are those ones that are extremely, there's no way this could be something that is true. Yeah, she's married to Michael Jackson. Oh no, or something like that. So, it gets to a point where it definitely sounds totally, out of pocket for a person to believe some of the things that they're actually saying that's happening and going on. So the most common cause of a psychosis is, we talked about schizophrenia, we talked about brief psychosis disorder, delusion disorder, schizoaffective, schizophrenia form, um, and then schizotypical personality. And then we talk about substance and medical induced psychosis, and then psychosis due to another medical illness. So those are sometimes some of the areas that we definitely see that there are concerns. A lot of times, certain mood disorder and different kinds of psychosis can also pop up. So, psychosis can also happen with certain types of disorders like bipolar, major depression, and other related conditions. And then, psychosis is, pretty much a collection of symptoms that happen with other mental health conditions as well. So, with that being said, a lot of times when we're looking at psychosis, things come up like brief psychosis. Again, sometimes we look at postpartum psychosis, and then we're talking about, again, substance and medical induced psychotic behaviors. So, experts excuse me, experts use to describe psychosis with different types or terms, but it's very common. Pretty much, it's not very well, excuse me, it's not very common anymore. Basically, they try to stick to few conditions that use psychosis or psychotic in their name. So basically, when we're talking about that, the ones I mentioned earlier, pretty much brief psychotic disorder, and then postpartum psychosis and things of that nature. So we try to make sure that we are you know mentioning psychosis in the right way, and that we are using the terms correctly when we're diagnosing, of course. When we start talking about treatment, we talked earlier about some medications, and we talked about therapy. So medications, there are a good bit of different medications that some of our patients can come in on and tell us that they are using or they have used, that we already know kind of where we are in the game with them. So a lot of times when we're talking about psychosis, some of the common medications, sometimes you'll see some antidepressants, or you'll see lithium involved in some of their antipsychotic medication regimens. Um, we also looked at CBT as some of the therapy that individual will get on an outpatient basis or an inpatient basis. And inpatient is usually when a person goes into psychosis, yeah, they're going to need probably inpatient treatment a lot of times. Again, like I said, we'll get a person and they might be showing some behaviors, thinking they're climbing the walls and all these different things that they're doing, and very bizarre behaviors. And we're trying to figure out what's happening, what's going on. So we're going to try to, put them on an observation status where they'll be in the hospital for a few days so we can kind of see what's going on and see if this is something that's going to wear off, like they, took something, or, whatever the case may be. And if it wears off, then we're like, okay, this person was, sometimes people get into a point where they're really sleep deprived, or some people get to a point where they actually took something, or some people get to a point. It's just a lot of things that can kind of happen. But in any case, we definitely want to make sure we're diagnosing correctly. So a lot of times we are observing to kind of see what's going on. And typically, where I'm at in the hospital, we really try to get to that point, and we try to make it known to our medical doctor and our psychiatry team that that person may need to sit for a little while for some observation. They can make the decision to do whatever else they need to do with that, but you could just tell them what you see and that you're not sure, and that they have to make the final decision, which means that they're probably going to observe the person and take a more closer look. So that's kind of what happens a lot of times. If the person doesn't end up doing an inpatient stay, if they clear up in a few days, then that's sometimes that happen. A lot of times with treatment, also support programs or support care is needed. So people are experiencing psychosis, if it's dealing with other conditions such as alcohol or substances and personality disorder and things like that. Basically, trying to help those persons, having a social worker, have a family case manager, and things of that nature. To help work with them through a lot of reducing the impacts of psychosis and other related conditions. So it's a lot of different things to help to manage, and helping the family and the patient to manage for the most part. So when we're looking at prevention, though, we're looking at avoiding recreational marijuana. That's one of the things that we see a lot of in the hospital. This is not a statement that people are just being like, oh my goodness, marijuana is not like that. Well, no, we're seeing a lot of recreational marijuana use early in life that are bringing a lot of people into the emergency room with very different responses and very different situations and scenarios. So I think that being number one, that prevention, I think that's something to consider. And then wear safety equipment. When you're doing certain activities and things like that, head injuries could be having brain damage could be a cause of a person going into psychosis as well. So that's another thing to think about. Don't ignore infections in the body, eye, ears. Things can spread to your brain that could cause psychosis, even though it's from a medical condition. Eating balanced diet and maintaining healthy weight. That's also something that you want to be mindful of, because, of course, when we're talking about the heart, we're talking about, especially if a person end up having a stroke and things like that nature, we definitely want to make sure that you're healthy. So preventing stroke and similar conditions can reduce your risk of developing psychosis. Um, Another one is, what is the difference between we're getting to the point of what is the difference between psychosis and schizophrenia. So here's where it comes down to. When we're talking about schizophrenia and psychosis, there are two strong connected words, but they aren't the same thing. They're not. When we're talking about psychosis, this is a collection of symptoms that involve, and we talked about this earlier, the disconnect from reality and the world around you. Psychosis can also happen if there are, many different type of medical conditions, like we just mentioned earlier, strokes and heart attacks and things like that. That nature could affect the brain, and then mental health issues as well. So when we're looking at schizophrenia is a condition and a spectrum of related disorders. Psychosis is a key symptom of all these conditions. So schizophrenia, you're looking at psychosis as a key symptom of all of these conditions. So basically, that's kind of how we're looking at it. When we look at schizophrenia is a disorder that affects the person's ability to think, feel, and behave clearly. The exact cause of schizophrenia isn't known, but a combination of genetics, environment, and altered brain chemistries and structure may play a role. So schizophrenia is definitely characterized by basically by thoughts and experiences that seem out of touch with reality. Pretty much disorganized speech and behaviors. I've seen a lot of that. And decreased participation in daily activities, not taking care of yourself, not washing, not cleaning, not brushing your teeth, and things of that nature. Those things to come into consideration. And also uh, difficulty with concentration and memory. That's also something that can be present as well. The treatment is usually a lifelong continuation, and it often involves a combination of medication, psychotherapy, and coordinating specialty care services. So, a lot of times, individuals need a lot of support working through schizophrenia, and a lot of families need a good, good bit of support with individuals that end up diagnosed with schizophrenia. So, schizophrenia is a serious mental disorder. We call it persistently mental disorder a lot of times. Um, and which, the individuals do not have reality. Their reality is, they're not intact with it. They're not definitely, yeah, they're definitely thinking other things. Their reality there is definitely abnormal. Um, Schizophrenia may result in some, combination of sometimes the individual might be having hallucinations, delusions, extreme disordered thinking. So they're very distorted. They not sure what's, yeah. And then the behaviors that impact their daily functioning, that stuff do fall by the wayside as well. And it could also become very disabling to some individuals. People with schizophrenia require long-term and lifelong treatment. And early treatment may get some symptoms under control before serious complications develop and may help improve a long-term outlook. So schizophrenia is very serious. A lot of times when we start looking at symptoms of schizophrenia, um, it's a lot of problems that come up when we're talking about thinking, the cognition, behaviors, emotions, signs, and symptoms may vary and usually involve delusions, hallucinations, disorganized speech, and reflect an impaired ability to function. So basically, symptoms may include delusions, hallucinations, disorganized thinking. We talked about all of those. All of those basically, the delusions are the false beliefs that are not based on reality. The hallucinations pretty much are when they're seeing things, hearing things, or things that are not there, or feeling things that are something crawling on their skin is not there. Disorganized thinking, they're very disorganized thinking or disorganized speech, very can't stay on track, can't put the words together, having sometimes what we call word salad, not being able to understand what they're saying, or things seem pretty meaningless, or putting it together in a meaningless way. So yeah, a lot of that happens sometimes. I've also seen where speech is totally gone. A person just kind of mutes out on me, and that's a part of that particular person's issue. And over the years of working in the emergency room, we know that, oh, when Jack Blow come in, Jack Blow is one of our ones that when we see him like this, we know where he's going, and he's going to get to the point where he is mute and he's not going to talk to us at all. But that's a symptom of his schizophrenia. So, we start to learn and know our patients, and sometimes families will bring them in and say, oh my goodness, he's doing the same thing he did a year ago. And we're like, yeah, remember when he came in last year, he was really bad off. Right now, he's not as bad off, but we can see him teetering back and forth that he could possibly get there. So that's something that we definitely see a lot of in the emergency room. And we see a lot of if you've ever worked on an ACT team. I've worked on an ACT team and everything. So I've seen that as well. So extreme disorganization or abnormal motor behaviors, that happens as well. From childlike silliness to unpredictable agitation, things like that can happen. Behaviors can include resistance to instruction, inappropriate or bizarre posturing. So a lot of stuff can happen. Yeah, yeah, it could be a lot happening. Lack of response and things of that nature. Negative symptoms. When you talk about negative symptoms, we're talking about reduce or lack of ability to function normally. They're just not. Yeah, a person may neglect personal hygiene. We talked about earlier, not brushing their teeth, getting up, fixing their hair. Um, yeah, doesn't make eye contact, doesn't the facial expressions doesn't change your facial expressions. Yeah, start to speak in a monotone. So things start to happen, and you definitely want to be, mindful of it. They definitely lack they're not experiencing any pleasure. They have a lack of that. So yeah, social activities is something that's a no. So when we're talking about symptoms in a teens, we don't see many teens come through, but when we do see teens that are coming through with certain things that are happening, and they are in a schizophrenia, in the early states of schizophrenia, whatever the case may be. um, what I got from the research was that schizophrenia in teens is similar to those in adults, but the condition may be more difficult to recognize. So a lot of times, again, as 18-year-olds, we typically, are looking at that, but we're not really diagnosing 16, 17, 18. We're not really diagnosing them with schizophrenia. We're trying to figure out what's happening and what's going on. If we do have to give them a diagnosis of schizophrenia, then we go for it, and we, get with the doctor, the medical doctor, as well as a psychiatrist, to make sure that we are doing our darndest to make sure that we are able to focus on making a diagnosis of schizophrenia. So, with that being said, we also go into some of the symptoms that you would see with schizophrenia in teens. They're common for typical development during teenage years. So, we see these: the withdrawal from family and friends, the drop in performance at school, trouble sleeping, irritability, depressed mood, lack of motivation. We look for all those things, and then we try to make sure that, some of those other things, if they're happening, like the voices and the delusions and things like that, we try to, horn in on those things to try to make sure if we're going to make a diagnosis like that. But a lot of times they don't get the diagnosis until they're young adults. Factors to consider: although the um precise cause of schizophrenia isn't known, I would say that, there are certain factors that we're kind of like, the increasing of the risk and all this other good stuff of developing, and triggering schizophrenia. We've seen things like having a family history, our family member that has been diagnosed with schizophrenia, some pregnancies and some birth complications. If we also consider some malnutrition and exposure to toxins or viruses, can impact the brain. So the development of the brain can be impacted. So that's also a consideration. And then taking mind altering, psychoactive or psychotropics, the drugs during teenage years and young adulthood. Those definitely are risk factors. And then when we start talking about treatment again, we talked about the treatment being a long-term scenario as well. And we talked about we talked about medication earlier as well, but now there's some neuro medications out there. I was just going to name a few that I see here, that are normal that we think about as the Respidone. Let's see, we usually see some Halidol, the Prolixin. Yes, these are some of the common ones. So those are some of the ones that we do recognize, and there are some side effects. There are low side effects. There are, interesting side effects. But I always tell individuals, like, everyone's gonna have differences in, what they're taking for the most part. A lot of time for schizophrenia, big ones right now is getting the injections, and they do injections of Respidol. I think they still do injections of Halidol, and then they have the injection of the oh goodness, I can't think of the name of it right now. The miracle drug. Um, I can't even think of it. Okay, but I'll come back to that in a minute. But that's one of the big things about it. If you are taking any types of medications, a lot of times it is a tough thing for individuals to stay med compliant. So having the shots given to them is always a major part of being med compliant. But I would say that's one of the biggest things that we have that that comes up in the hospital. Invega, that's the one, the miracle, we call it the miracle drug, because the Invega, a lot of times is one that when it's given, it's an injection that can go 3 months, 6 months. It's a pretty powerful injection, and we can tell when a lot of our clients are coming down off of their injection. So it's the long acting injectable. So a lot of times when we know that they're coming down off of it, Abilify is another one. When they're coming down all off of it, there's a lot that's happening, a lot that's going on. I think Prolixin is one that they can do in a long active injectable as well. So, support groups, rehabilitation training, these are different things that do come up also when it comes down to treatment. When we're talking about schizophrenia, cognitive behavior therapy, psychoeducation, family therapy, and group therapy also. So those are a lot of things that really help our families through for the most part. Being in support groups, NAMI, and reaching out to other mental health support groups in the area is something also that we encourage families to do. But a lot of families, with that much going on, they kind of don't know where to turn, or you know how to make things, they don't know how to make their new norm, their new normal, I guess, is what I say a lot of times. So, but again, this is just kind of giving a big overview on the difference when we're talking about psychosis and we're talking about schizophrenia. um, just giving a big overview of the difference between the two, and just wanting everyone to be abreast of it and kind of know that there is a difference. But you do start, when you start going into schizophrenia, you do start seeing psychotic type behaviors, with your hallucinations, your delusions, and things of that nature. So I hope this has been a eye opener for everyone, and everyone enjoy this presentation. I did not reinvent the wheel. I just went ahead and stated the information that's typically already there. Again, I used a couple of websites to get the information, the resources are at the end. And if there are any questions, of course, you can always either leave us a message, or you can give us a call, or send us a nice little message about, what's different, what's going on, and anything that we can possibly be able to help you with. Again, this is Dr. Latasha McElwain. I hope you enjoy the rest of your day, afternoon, or evening.